And which side would I want to work on first? The non-symptomatic side. So I have them lay on their left side with their right side up, please. We can leave the pillow there. We'll see if that feels comfortable to lay on, or would you want that out?
I can stay.
Okay, cool. Let me grab the other pillow. Okay. Voila. And I have to ask myself, is that pillow thick enough? Does that feel comfortable? Looks about right. Now, extra piece, next piece. Square bolster, leg. Hey, comfy? Good. Now massage, massage, massage. This is where all the neck and head stuff comes in. I can, even if I don't do deep release work here, I can maybe say, hopefully I'm sending a signal via the cervical spine and skull to the SI joint and lumbar spine and pelvis. A nice, even just gentle, thorough head squish is an amazing thing. Around, some of the positioning. Here, take your arm, here, roll. Sometimes all of this can be used, yeah, you can, or just flop. Can be used as a way to actually adjust the person into a more symmetrical position. Make it feel like massage, but it's not me saying, hey, can you get more on your shoulder, square up for me? If I just grab their arm, do some nice stuff. And while doing this, it can just be a question of like, what do you sometimes find? Like I find a little thing there, I can roll the arm around. This hand now, instead of being up here, comes down and thinks about the scapula. This will matter more for our neck, shoulder person. And I'm here, okay, arm down. If I hadn't massaged here all, this is where I could be doing all this good stuff. I really feel like this works great.
So technically, aren't you kind of working on the
working the opposite?
Yeah, right.
Yes, yeah. I'm working more on the left spine,
yeah.
Left erector spinae. So in this position, what I'd have to do then here is, at least for this part, bring in some more light gentle glides. Here's, I can grab right a hold of that trap. Use it like a handle to help like stabilize them and give me some counter pressure. Okay. Now this isn't the symptomatic side, but even if there's nothing bad going on, if you push hard enough anywhere, it'll create a sensation, right? So don't misinterpret intense sensations as being always related to something wrong. Okay? I'm going to sink in. You tell me the pressure's just right. Now, I'm going to speed this one up because it's the less ornery side. But I just coach client, okay. Now, real small, it can just be you're just starting to actually lift it. And you just start to pick up your bottom leg off the table. Wow, perfect. Hold it there. Now, how big of a movement did that look like? So small. And slowly, slowly, let it back down, nice and slow. Now, I'm trying to get fancy with incorporating a few things, especially breathing related. The abdominal muscles touch the ribs. Quadratus lumborum touches the ribs. So why not think about breathing related to all of this? And if you're in pain and the low back starts to get tight, isn't that kind of getting stuck with a wrap around your whole abdominal area? And that can limit diaphragm breathing all by itself. So I find a spot, Now I could do breathing instead. Say like big deep breaths. Big inhale, good long exhale. As she inhales, like I feel the tissue changing shape right underneath what I'm pushing on. So that can be part of it. Or I could couple the two together and go, all right, now I'm gonna have you lift your bottom leg just a touch. Hold it there just for a few seconds. Now keep holding it, big deep breath in, all the way in. And then as you exhale, slowly let the leg back down. And hopefully we get 2 for 1. And I start working my way further back. And what's cool is for any area, lateral to posterior, lifting that bottom leg will work for you. So, all right. Around. Make sure good foot massages. Can't go wrong. This top one is my favorite. So trying to get toes to do things more. So there isn't a really important aspect with that where ideally, I mean, I like to say I could show everything that exists in my brain, but I've probably forgotten more than I ever knew. But the importance of a big toe is huge. So I try to find moments where I squeeze around what we call the ball of the foot, but it's really the metatarsal, first metatarsal, and just get that toe back and forth, and sometimes try to make it move into extension while I take the other toes into flexion. Nothing crazy, just little ones.
Feels good. It feels like it's stretching.
Yes. And the intrinsic muscles of the hands and feet, the lumbricals and interossi, that's the only way to facilitate getting any kind of pliability there. They're in between the metatarsals. So you have to shear those long bones back and forth a little bit to get those to free up. If they're really stuck, they're the adductors deep in your foot for your toes and your hands. My finger joints, my phalanges aren't doing this. It's between my metacarpals. Okay. Now we'll have you lift your knee up nice and slow. And then big flippy flop. Going off the sides. I'm always there if you notice, by the way. I haven't had a casualty yet, and it's a lot of like, I got it. All right. Yeah. Perfect. Okay. A little sanitation. Balance out the head scritch. Scritch, technical term. Pillow not in an ideal spot. When I was doing neck work, I have to have them lift their head up a little bit. Scoot that pillow over. I want there to be enough space in front of them so if they roll, the pillow catches them. I don't want them rolling off that pillow. Hand placements. If anything, as I said, balancing out chemical soups. Sometimes I'm just doing something nice because I'm hoping to send some serotonin and dopamine in there, not just a bunch of endorphins. Okay, grab that one. Here we go. This gets me set where I can go. All right. I'm lining up based on how I can see the thorax, trying to get basically them as lined up as possible. And then hand on scapula, move, move, move. There is an important bridge between the shoulder and the low back, latissimus dorsi. Okay? That is a huge muscle, especially in terms of how much overall coverage it has on our back. But big adductor of the shoulder, but it goes right into the lumbar dorsal fascia of the low back. So where the two components can certainly be correlated is in that one. And when I'm working here, some extra things I could do is have them take their arm up and out into abduction and create a stretch of the low back, actually using shoulder movement to pull that off. So, here, let me warm everything up a little bit. Gotta be nice. Important to remember to be nice. And where the rhythmic component can make just a static compression at least feel more interesting, right? If I just did this, that's kind of boring for everyone, right? If I'm here with my non-working hand, just kind of rolling that shoulder around, nothing too precise, more or less what actually feels convenient for me. And maybe I can be getting more to happen. If I'm getting real fancy, this hand may start searching for scalenes while I'm working on QL at the same time. So, but start out with one thing at a time. That's where I could passively, I used to do this quite a bit because I'd just be knocked out. I'd be like, okay, I can get both of these at the same time. But be careful and mindful of your body mechanics. All right, now I'm gonna come more straight down. Pressure.
Good.
Okay, a little bit more, or is that about right?
That's good.
Okay. So we're gonna start with the leg movement. Little lift to the bottom leg, real small, that's good. Hold, 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 hold. And slowly back down, nice and easy. What's great is if you teach the clients how to do this right the first time, successive sessions, they'll start knowing exactly what to do. Reached a point where it was a lot of me just tapping people because they would know exactly what the thing to do for this spot was. So lift that leg, hold it, hold it, hold it. Big deep breath, all the way in, all the way out. Slowly let the leg back down, nice and easy. Now I'm going to check in regarding where does it feel more symptomatic. I'm going to track more anterior and see if that feels different. Going that way versus this way.
That one.
Okay. I'm going much more straight down. This would be more likely quadratus lumborum meeting, that lateral raphe, as opposed to it being obliques. So, all right, pressure's still okay. Okay. We could do other things, corollaries with this. If not the leg, maybe you lift your head up. Lateral flexion, kick on lateral flexors, same side of the spine. Big deep breath. All the way out and let your head back down. This is where I could you can get inventive, but pick ones that initially are best for you body mechanics wise. Okay. Now, searching. Now, how do these spots compare?
That feels like it's doing something.
Okay. Usually it's a little bit of a lot, not ever just one thing. So get a spot, do a couple interventions, move on to the next thing. Don't irritate the one spot. Okay, a little lift of the leg. Gonna get on scalenes a little bit at the same time. Big deep breath, all the way in. And all the way out, let the leg down, nice and slow. Let's get even crazier, where, okay, little lift of the leg, little lift of your head, real small. Big deep breath in, all the way out, and let both down. Nice and easy, nice and easy. You can layer and layer. Good. Now I'll keep tracking back. So I'm just increasing my elbow angle. I'm scooting back bit by bit, increasing my elbow angle so I'm more and more on the posterior side of the body. So I went from kind of lateral raphe, QL, to now erector spinae. Okay. Pressure? How's that one compare?
That's good. That one doesn't hurt.
Yeah, I was like looking at, a lot of looking at people's eyes. We're like, yeah, you don't seem symptomatic. Everything seems fine. Paying attention to how they're breathing. In this setting, it's way harder for me. Usually in other places, I can just be like, yeah, that one's not triggering anything. It was more of this stuff. We're in there.
Yeah.
We'll do one more good one. Just a couple good deep breaths. Big, big inhales. Good long exhales.
I can feel it going further and further.
So that was already good feedback. But you may have to encourage that by being like, hey, no, I felt something change. I felt the area soften, release. But I would, instead of going, did you feel that release? I'm amazing. I would go, did you feel that? Did that change? Any different? And if I hear yes, you got better? And I said, yeah. Yay. Go balance out the foot. This is where just drawing on a bunch of maps. I'm like, I don't know. They say the arch of the foot is connected to reflexology and the arch of the foot near the heel, so maybe I'll focus some attention there, because why the heck not? You know, I don't believe in necessarily having to prove every tiny little thing, but I love the idea of creating a really good stew of many little ingredients and never too much of any one thing. I think you don't overwhelm the system. The problem with that is it's harder for you to know which part of the treatment was really the big factor that helped. And it probably wasn't any one thing. It was probably the collection of things. I get that that's just frustrating. You want the one release to do that solves it all. But part of the safety of this is not overworking any one spot for too long in one position.